Well, this week is Infection Prevention Week. So to explain how preventing infections improves patient safety is infection control practitioner at GBMC, Molly Hyde. All right, so thanks for being here. Now, can you discuss GBMC's patient safety programs with a focus specifically on infection prevention?
Yeah, absolutely. So infection prevention really touches all aspects of patient care. So we have many different programs for infection prevention at GBMC. All of our staff is required to undergo training on infection prevention when they're first hired and then every year. And then we also audit our programs throughout the year. And that gives us a chance for real-time education and to determine how well our programs are doing. And then we also do a lot of patient education. So anyone, for example, who has had joint surgery at GBMC will have the opportunity to attend a class so that they can learn how we are going to help prevent them from getting an infection, but also what they need to be doing at home, because we recognize that infection prevention really starts before you even walk in the door and continues after you leave.
So how much of a challenge do hospital-acquired infections present to the healthcare system as a whole?
Yeah, so despite hospital-acquired infections decreasing over the past decade or so, they still are a significant challenge for the healthcare setting. So CDC estimates that about 3% of hospitalized patients will get a hospital-acquired infection. So that's over 1 million people a year. And it really speaks to the challenging environment of a hospital, because it is where people go to get care when they are sick. And so naturally, there is a lot of germs in a hospital, which is why it's so important to have a really good infection control program.
For sure. Now, can you talk to us about the most effective method that you have there at GBMC to prevent and control those infections?
Yes, absolutely. So the most effective method to prevent the spread of germs is hand hygiene. It's cleaning your hands either with soap and water or with hand sanitizer. And that's not just within the hospital, that's everywhere. So if you're at home and you want to avoid getting sick, wash your hands.
I love it. Okay, can you tell us quickly before we let you go how you're focusing on improving the patient safety and quality while preventing those infections?
Yeah, absolutely. So we're really always looking for new avenues to improve our infection control programs. Right now, we're looking at how to utilize technology to help improve patient care and improve infection prevention. So we recently actually just purchased some machines to do high-level disinfection of our ultrasound probes. That's just one example. These are our new advances in disinfection. We are also looking at electronic monitoring for hand hygiene and looking at the use of new disposable patient supplies to reduce the risk of infection spreading from patient to patient with shared supplies. So there's a lot of new technology out there, and we're really looking to use it to help reduce our infection rates.
Great work that you were doing there. Thank you so much for joining us today, Molly. Thank you for what you do.
Thank you.